Hi guys!
Hi everyone, Dr. David here, and we have Dr. James and Dr. Jeremy with us, coming from the Hunter Valley practice today. Today we're talking about a pinched nerve. I'm not sure if you heard of a pinched nerve before. Usually when the people are diagnosed with a pinched nerve issue, they will usually complain with some sharp shooting pain going through their peripherals, so their arms and legs. You don't really have to have a trauma to get this pain. A common, a classic example actually is a sciatica. So patients with a sciatica comes in and complain with their pain shooting down the back of their leg and often going down to their foot. Now, Dr. James, would you like to talk about radicular pain?
So basically sciatica is one example of what we call radicular pain. So this, by definition, is pain that's caused by nerve root pain, and you'll feel it down the arm, or the leg in the case of sciatica. So it follows the path of the nerve root, but it can affect things like how we feel pain, how we can move, what sensations we can feel, because there are different types of nerves in the body as well. They'll pick up on different things. So you might find that when you have this radicular symptom, you might only have pain, but you have full function. Or you might have very little pain, but limited function, so limited ability to move the limb itself. It depends on what has actually been impacted on there as well.
Interesting. So there's a couple of ways that the nerve can actually be irritated. One is mechanical irritation, which can be obviously like that the nerve has actually pressure on it, like a degenerated disc or osteoarthritis, for example. Another way can be chemical irritations. That can mean like the chemistry of our body is out of balance and there's inflammation in there, stirring the nerve up for some reason. And all these things then relate and can cause nerve issues like what the doctors have already spoken about here. So some of the nerve issues and the ways that we identify that can be as simple as pain shooting down through the nerve tract, like Dr. James just explained. Other ways that we can determine that there's a nerve issue, because it doesn't just have to be pain, it can be actually weakness in a muscle, and we call that myotone weaknesses. There can be changes in reflexes, and that's the things that we check out as well. So to determine if you do have a radiculopathy or if there's pain, you want to know if it's related to a nerve injury, we do these tests on you. We take a proper history, we do a very thorough examination using some of the things that I've just spoken about there. And once we have that data, we can do some stuff with that.
Yeah, so by knowing what exactly is causing your issue, we can then formulate a care plan for you and see how we can help you.
Yeah, absolutely.
Yeah.
So
we know that there is some really good research too, based around all of this.
yeah, so there's research that tells us that chiropractors are good at helping with nerve irritation, especially for the neck and the low back.
Absolutely.
So two really, really common things that we see a lot of.
So don't put up with radiculopathy symptoms. They're really annoying, they happen, they're very, very common. Get in, let us check them out for you, and we can let you know if we can help you or not, and formulate a care plan if we think we can help you. If you know anyone out there that's putting up with radiculopathy symptoms, make sure you get them checked out, because we know over time these things can really cause a lot of trouble and can make you feel cranky and annoyed, and we don't want that either. Have a great weekend, guys.
Happy Father's Day.